Feeling tight and painful around the sides of your hips, in your groin, or having lower back pain, or even caving knees with squatting are all symptoms of weakness in the outside of the hips, particularly in the gluteus medius and minimus muscles, which are different from the big glute max muscles around the back. To activate these when they are weak, you're going to need to be as specific as possible to them, which is where getting the right technique for your activations comes in. To isolate the glute med and min properly, you want to lie on your side with your legs straight, kick back in line with your body. From here, you want to roll your hips slightly forward so that we can avoid using the front outer hip muscle called the TFL and focus all our stress on the back side of the glute where the minimus and medius sit. From there, you're going to want to elongate your leg, reaching your foot as far away from your body as possible and dropping that side of the pelvis down a bit to make sure that we're isolating the hip from the lower back. Once you're here, slow raises, lifting your leg up in a straight line as far as you can before you start to feel that pelvis hike. We'll make sure that you're isolating the hip and then bringing it back down again, keeping the pelvis stable and letting the leg drop all the way down as far as is comfortable. We'll make sure that you're using as much of that hip's active range with as little of everything else as possible. You should feel this as a bit of a pull or burn somewhere in the back of the hip, anywhere from the high part of the glute down to the side of the thigh, and you want to perform enough repetitions here until you're starting to struggle, get some shakes, or lose some of that form. To focus more on hitting the TFL on the front outer part of the hip, you do the opposite by rolling the hips back, slightly facing towards the ceiling, and then lifting the leg from the lower position up high while keeping the toes still turned in a bit. This will have more range than the glute medius, as your hip should have more room to move here, but the same applies. You try to limit the lift to your hip and try and avoid any excessive pelvis or lower back movement.